Having diabetes can be difficult, but you are not alone. We are planning to restart the diabetes support group in August. It will be the third Tuesday of each month, starting August 15th. We will have providers from Salina Regional, as well as other healthcare professionals from around Salina to come and talk about different aspects of having diabetes. I'm Ethan Leiker, a pharmacist at Salina Regional Health Center.
Ethan, thank you so much for coming on the show. Let's start our talk about diabetes out with talking about the prevalence of diabetes.
Yeah, so the American Diabetes Association in 2019 found that about 36 million people, or 11% of the US population, lives with diabetes. And then they predict that another 93 million, or about 34% of the adult population, lives with prediabetes, which increases their risk of developing diabetes.
As a pharmacist, what are some issues that you see that people have with diabetes?
So there are a bunch of different issues. One can be if their blood sugars get too low from not eating. It can cause shakiness, sweatiness, fainting, and a lot of significant issues. Patients who have regularly high blood sugar levels can end up having problems with their vision, with tingling in their feet, with ulcers on their feet, with nerve issues. And then if patients have really high blood glucose, it can cause nausea, vomiting, and require them to be hospitalized for it. Other issues I see as a pharmacist are the medications can be very confusing, and then lifestyle issues. So they have to track what they eat. They may have to eat more frequently. People with diabetes can notice issues after they eat with their blood sugars, and it can also require them to use medications to better control their blood sugars after they eat. So with that, we've decided to restart the diabetes support group program that we used to do with our pharmacy residents.
So what are you doing now?
So our goal is to bring it back to a very similar format to what they did. So we'll have a presenter once each week. So our goal is to have the third Tuesday of each month, and they can talk about different topics that we can talk about a little bit later. Along with this, we plan on having a question and answer session. So if there are any questions to the presenter or anyone who's present, because our goal is to have multiple different healthcare professionals there, not just pharmacists. We're going to have diabetes-friendly meals, as well as the recipe on how we made those meals, a raffle with items that can help people with diabetes, and then our goal is to kind of continue to expand, and we're looking for information from the members of the support group as to what they would like to see and what they would like to know more about. It's available to all of the community. It's kind of geared towards people with diabetes and their family members, but anyone who wants to learn more about the disease state and get information surrounding diabetes is okay to attend.
Okay, thank you so much for some great information, and thank you for watching. For more information, visit srhc.com and like Salina Regional Health Center on Facebook. Follow us on Twitter and Instagram.